Swayam Prabha. Digital India. Educated India.
Hello, I am Dr. Pallavi Bajpai from Dr. D.Y. Patil Medical College, Pimpri, Pune. The topic is deep cervical fascia. In the first picture, you can see a large reddish colored area. This is a parotid abscess. In the second picture, you can see a swelling in the region of the oral cavity called the posterior pharyngeal wall. This is a retropharyngeal abscess. We will be learning about these two conditions and other such conditions based on the anatomy of deep cervical fascia. So, I will cover my lecture in the following headings: introduction, function, parts, details of each part, that is the extent, attachments, modifications. Then I will talk about various spaces in the neck, and lastly we will talk about clinical anatomy. What is deep cervical fascia? It is called fascia colli. It is like a collar which surrounds the neck. It is a deep fascia and it is made up of areolar tissue. What are the functions of the cervical fascia? If we understand the function, we are able to understand the fascia better. It provides support to various viscera like the thyroid gland, the muscles, vessels and deep set lymph nodes. It condenses around major vessels in the neck to form carotid sheath. It forms cleavage planes so that tissues can be separated during surgery, and these planes also limit the spread of abscess or collections of pus. This fascia allows slipperiness, that is, it allows structures in the neck to move and pass over one another without difficulty during acts like swallowing and turning the head and neck. Now, what are the parts of deep cervical fascia? It has various parts. The first part is the investing layer of deep cervical fascia. The second part is the pre-tracheal layer. The third part is the pre-vertebral layer. Then it has the carotid sheath, the bucco-pharyngeal fascia and the pharyngo-basilar fascia. We will talk about one by one all of these parts. So, the first one, the investing layer of deep cervical fascia. Now, this is a diagram showing you a transverse section of the neck. This is the bone, the cervical vertebrae, and in front of the cervical vertebrae, this is the esophagus. This is a section of the trachea. Around the trachea is the thyroid gland, and then we can see these brown colored structures. They are all the muscles. These are muscles in front of the neck. These are muscles in the posterior aspect of the neck. Then laterally we can see this. This is the carotid sheath containing the important vessels of the neck region. Now, if we start from outside and pass inwards, we can see that after the skin and superficial fascia, this green colored line which is passing all around the neck. This is the deep cervical fascia. It surrounds the entire neck just under the skin and subcutaneous tissue. What are its attachments? Superiorly, it is attached to the external occipital protuberance, the superior nuchal line, the mastoid process, the external acoustic meatus, and to the inferior border of the mandible. Inferiorly, it is attached to the manubrium sterni, the clavicle, the acromion process and spine of scapula. Anteriorly, it is attached to the symphysis mentae and the hyoid bone. Posteriorly, it is attached to the spine of C7 cervical vertebrae and in this region to the nuchal ligament. So, if you see this diagram, this red line that you can see, that is the deep cervical fascia, it is the investing layer. This is the fascia posteriorly, and anteriorly we can see it passing from mandible to hyoid bone and in front of the neck down till the sternum where it is splitting. This fascia splits. It splits into two layers at various regions, a superficial layer and a deep layer, and it encloses muscles. When it splits, it encloses two muscles. The muscle posteriorly which is it is enclosing is the trapezius muscle, and the muscle which it is enclosing anteriorly is the sternocleidomastoid muscle. It also splits to enclose two glands. So, again if we trace the fascia from the hyoid bone up to the mandible, we can see it is splitting into a superficial layer and a deep layer. Here it encloses the submandibular gland, and as it passes further up from the mandible to reach the zygomatic arch, again it splits into a superficial layer and a deep layer, and it encloses the parotid gland. Here the superficial layer attaches to the zygomatic arch lower border and the deeper layer attaches to the tympanic plate just below the external acoustic meatus. The deep cervical fascia is thickened to form two structures. The first is stylomandibular ligament and the second is parotido-mesenteric fascia. Now we come back to this diagram. As the fascia ascends upward, it splits into two, a superficial and a deep layer. This superficial layer which attaches to the zygomatic arch, this superficial layer is called as the parotido-mesenteric fascia. It is very tough and unyielding, it does not allow any stretch. The posterior layer goes and attaches to the tympanic plate under the external acoustic meatus. This posterior layer shows a thickening in the middle, that is called as the stylomandibular ligament. The stylomandibular ligament is attached to the mandible and to the styloid process. The investing layer forms slings to attach two tendons, the digastric tendon and the omohyoid muscle. This is the mandible. Starting from under the mandible is the anterior belly of digastric from the digastric fossa, and this is the posterior belly of digastric attaching to the mastoid process. Between them is the intermediate tendon. This tendon is attached to the hyoid bone with the help of a sling which is formed from investing layer of deep cervical fascia. Now, when the fascia descends to attach to the clavicle, again it splits into two layers, a superficial layer and the deep layer. The deeper layer slings the omohyoid muscle. It forms spaces. The first space is called supraclavicular space and the second space is called suprasternal space of Burns. The supraclavicular space contains the terminal part of the external jugular vein and the supraclavicular nerves until they become cutaneous. The suprasternal space of Burns contains the sternal heads of the sternocleidomastoid muscle, the jugular venous arch, the interclavicular ligament and a lymph node. Looking at the diagram, we will understand these two spaces. The first space, supraclavicular space, this is the clavicle, this is the investing layer of deep cervical fascia. We can see it splits into a superficial layer and a deeper layer to attach to the upper part of the clavicle. As it does so, it encloses a space. This is the supraclavicular space. Then, when the investing layer of fascia passes to attach to the sternum. Again it splits into an anterior layer and a posterior layer, and within that it encloses a space called the suprasternal space of Burns. We can trace the fascia horizontally. It starts from the region of ligamentum nuchae, passes forward, splits to enclose the trapezius, reunites, and now it forms the roof of the posterior triangle of the neck. Then it again splits and encloses the muscle sternocleidomastoid. Then it reunites and forms the roof of anterior triangle of neck. So again, coming back to the diagram, we can trace the fascia from the posterior aspect. It is passing, splitting to enclose the trapezius muscle. Then it reunites and now it is forming the roof of posterior triangle of neck. Then it passes anteriorly, again it splits and encloses the muscle sternocleidomastoid. At the anterior border of sternocleidomastoid, it again reunites and now it passes anteriorly. Here in this location, it is forming the roof of anterior triangle of neck. So this was the horizontal tracing. Now vertical tracing. When we trace the fascia vertically, it splits at the lower border of submandibular gland into a superficial layer and a deeper layer. The superficial layer is attached to the lower border of the body of mandible. The deeper layer is attached to the mylohyoid line of mandible. At the lower pole of parotid, the fascia again splits into a superficial layer and a deeper layer. The superficial layer is attached to the zygomatic arch, and here the superficial layer is forming the parotido-mesenteric fascia. The deeper layer is attached to the tympanic plate, to the styloid process, and it forms the ligament stylomandibular ligament. Inferiorly, the fascia further splits to form two spaces, suprasternal and supraclavicular. Looking at the diagrams, we can understand how the fascia passes up from the hyoid bone, splits to enclose the submandibular gland, and finally attaches to the mandible. Then as it passes up from the mandible, it splits again to enclose the parotid gland. It goes up and attaches to the zygomatic process, it attaches to the tympanic plate, it attaches to the styloid process, and there the posterior layer forms the stylomandibular ligament. It splits to enclose a space called as the suprasternal space, and it splits to enclose a space called as supraclavicular space. To summarize, the fascia splits to enclose two muscles, trapezius and sternocleidomastoid. It splits to enclose two glands, submandibular gland and parotid gland. It is thickened to form stylomandibular ligament and parotido-mesenteric fascia. It forms slings to bind the tendons of digastric and omohyoid. It forms spaces, supraclavicular and suprasternal. It forms the roof of two triangles, anterior triangle and posterior triangle of neck. Now we come to the second layer, the pre-tracheal layer. The pre-tracheal layer is limited to only the anterior part of the neck. It provides a slippery surface for the free movement of trachea. So again, coming back to this diagram, this is the cervical vertebrae, this is the esophagus, this is the trachea, and surrounding the trachea is the gland, the thyroid gland, and we can see this blue colored line around the thyroid gland. This is the pre-tracheal fascia. The attachments: superiorly, the fascia is attached to the hyoid bone, then to the thyroid cartilage, then to the cricoid cartilage. Inferiorly, the fascia goes down and attaches to the arch of aorta, the fibrous pericardium which is covering the heart, and the suprapleural membrane or the Simpson's fascia. So, this is the fascia that we are talking about, this blue colored line. This is the pre-tracheal fascia, and laterally it contributes to the formation of the anterior layer of carotid sheath. It encloses the thyroid gland. You can see this dotted line. It encloses the thyroid gland to form a capsule of the thyroid gland, which is called as its false capsule. It is modified to form a structure called as ligament of Berry or suspensory ligament of thyroid. In the posterior part, the layer which is covering the gland attaches to the cricoid cartilage, and that is called as ligament of Berry. Now we come to the third layer, that is the pre-vertebral layer of deep cervical fascia. It lies in front of the pre-vertebral muscles and also surrounds all the other muscles around the vertebrae called as vertebral muscles. So, let us look at the diagram. This is the cervical vertebra. In front of the cervical vertebra here, these are the prevertebral muscles, and passing anterior to the prevertebral muscles, we can see this yellow line. This is the prevertebral layer of cervical fascia, and also we can see posterior to the vertebrae, these are the muscles around and behind the vertebrae. This fascia also encloses all these muscles. So, we can see it is enclosing the vertebra with the muscles in front called the prevertebral muscles and the muscles behind called as the vertebral muscles. The prevertebral layer forms the floor of posterior triangle. So, now let us look at the diagram carefully. We can see here the prevertebral layer passing laterally, and as it is passing laterally, we have come again to the same region where we had earlier learnt this green layer is the investing layer and it is forming the roof, and now here we have to understand this is the prevertebral layer, it is forming the floor. So, we have this region called the posterior triangle in which the roof is formed by the investing layer and the floor is formed by the prevertebral layer. Then next we appreciate this area. This is the area called as the neurovascular bundle of the neck region, and covering it is the carotid sheath. Inside it are the important blood vessels of the neck. So, in the posterior aspect of this carotid sheath, again we can see a contribution from the prevertebral layer. Then it is forming a large tubular sheath for the vertebral column and the muscles associated with it. So, which are these muscles? We have the longus colli and the longus capitis. Then we have the muscles, scalene muscles laterally, and posteriorly we have the deep cervical muscles. It is attached superiorly to the base of skull, and as it travels inferior, it forms two layers, an anterior layer and a posterior layer. The anterior layer is called alar fascia and it blends with the bucco-pharyngeal fascia. The posterior layer, which enters the thorax, it fuses with the anterior longitudinal ligament roughly at the level of T3, T4 vertebra, that is the third and the fourth thoracic vertebra. Laterally, it blends with the fascia over the sternocleidomastoid muscle. So, if we look at this diagram now, this upper part, this is the body of the sphenoid bone in the skull. These are the muscles of pharynx called as constrictors. This is superior constrictor, this is middle constrictor, this is inferior constrictor, and passing below them is the esophagus. So, this is the anterior aspect. Then we come to the posterior aspect. These are the bones of the vertebral column. The uppermost one is the second cervical vertebra, then the third, then the fourth and so forth, and finally we reach the level of thoracic vertebrae 3 and thoracic vertebrae 4. Now you can appreciate this orange colored line which is attached to the base of skull and it is passing just behind the constrictor muscles. This is the bucco-pharyngeal fascia. And just in front of the bones of the vertebrae or just in front of the vertebral column, we have this blue colored line. This is the anterior longitudinal ligament. So, we can see now the pre-vertebral fascia starting from the base of the skull, passing down, splitting into two layers, the anterior one called as the alar fascia, which is fusing with the bucco-pharyngeal fascia, and the posterior layer, the pre-vertebral layer, continuing down and in front of anterior longitudinal ligament all the way down till the level of T3, T4 vertebra. It modifies. So, the pre-vertebral layer shows a modification called as the axillary sheath. This axillary sheath is a tubular elongation, it is a covering, it covers the axillary artery and the trunks of brachial plexus. Then also within the pre-vertebral layer lies an important nerve trunk called as the sympathetic trunk. It is embedded within the pre-vertebral fascia. Now the fourth layer, which is called as the carotid sheath. So, where is the carotid sheath in this transverse section? This is the carotid sheath. It encloses the important artery, that is the carotid artery, the important vein, that is the internal jugular vein, and one nerve called the vagus nerve. So, this structure, this is the carotid sheath. It is a fascial tube which extends from the base of skull to the root of the neck. It is formed anteriorly by the pre-tracheal fascia and posteriorly it is formed from the pre-vertebral fascia. So, if we look at a vertical drawing, this is how we can draw it. It is like a tube extending from the base of skull to the root of the neck and it has three contents. So, the contents of the carotid sheath are medial most. First, the common carotid artery, and as it passes upwards, it divides to form the external carotid and the internal carotid. Therefore, inside the sheath we have common carotid and internal carotid artery. Then lateral to it we have the internal jugular vein, and between them this yellow line we have the vagus nerve, that is the 10th cranial nerve. If we see a cross section, then we can identify the common carotid artery, the internal jugular vein and the vagus nerve slightly posterior and in the middle. On the anterior aspect of the carotid sheath, we can see lying the ansa cervicalis. Ansa cervicalis is the nerve loop which supplies the infrahyoid muscles of the neck. And posteriorly, we can appreciate the nerve trunk, the sympathetic trunk or the sympathetic chain which lies within the pre-vertebral fascia. There are some structures which pierce the carotid sheath. The structures which pierce it are the external carotid artery which comes out of it, the tributaries of the internal jugular vein which pass into it, and certain nerves. The 9th nerve, which is the glossopharyngeal nerve, the 10th nerve, the vagus nerve, the 11th nerve, the accessory nerve, and the 12th cranial nerve, the hypoglossal nerve. These are all the structures which pierce the sheath and come out or go in. Now we come to buccopharyngeal fascia. Buccopharyngeal fascia lies posterior to the esophagus. So, let us look at the diagram and identify the esophagus. This is the trachea, and behind the trachea lies the esophagus, and behind the esophagus we can see the cervical vertebrae and the prevertebral muscles. anterior to the prevertebral muscles, we can see the prevertebral fascia. So, just behind the esophagus, we can see this layer passing horizontally, that is the buccopharyngeal fascia. So, the buccopharyngeal fascia lies posterior to the esophagus and it separates the esophagus from the prevertebral fascia. It also forms the anterior border of a space called as the retropharyngeal space. We will be talking about this space in a moment. Tracing the buccopharyngeal fascia in a vertical section, you can see this blue line. It is passing from the base of skull all the way down. That is the buccopharyngeal fascia. Now, the sixth layer, that is the pharyngo-basilar fascia. Again, we orient ourselves to the same diagram, the sphenoid bone, the constrictors of the pharynx, the esophagus, the buccopharyngeal fascia, the prevertebral fascia, the anterior longitudinal ligament, cervical vertebrae. So, this pharyngo-basilar fascia is a fascia which lines the inner aspects of the constrictor muscles of the pharynx. It is appreciated best, or it is seen thickest above the level of the superior constrictor, where it is closing the gap between the base of skull and the upper border of the superior constrictor. Now, we come to spaces in the neck. There are two spaces in the neck, the retropharyngeal space and the lateral pharyngeal space. So, here the green arrow is showing you the retropharyngeal space. There are two on either sides, and the lateral pharyngeal space, two on either sides. So, let us understand this diagram first. So, here we have got the cervical vertebra. In front of the cervical vertebra, we have got the prevertebral layer of fascia, and if we remember, the prevertebral layer attaches in the midline to the buccopharyngeal fascia. So, we can see it here attached. Then coming anterior to that, this dotted line that we can see passing laterally on both sides, that is the buccopharyngeal fascia. Inner to the buccopharyngeal fascia, we have the constrictor muscles of the pharynx, the superior constrictor, and anterior to that we have reached the space, the posterior pharyngeal wall. Laterally we have the tonsils and anteriorly we have the tongue. Then coming outside, here this is the mandible, the base of the mandible, this is the ramus of the mandible with the attached muscles, this is the parotid gland, and coming behind, this is the muscle sternocleidomastoid muscle with the covering of investing layer of fascia. Medial to that is the styloid process with its muscles attached, and behind that is the carotid sheath with its contents. So, once we have understood this diagram, what we realize is there is a space between this midline junction of the prevertebral fascia with buccopharyngeal fascia, this fusion and the carotid sheath. So, this space here, this is the retropharyngeal space. So, we have two such spaces on either side. Why it is important? Because it contains the retropharyngeal lymph nodes, and it is very important also because it communicates below with the mediastinal space in the thorax. Then we come to the next space, the lateral pharyngeal space. It is also called as parapharyngeal space. So, where does this space lie? It lies medial to the parotid gland and lateral to the buccopharyngeal fascia, but it is lying in front of carotid sheath. So, very important, carotid sheath is separating this lateral space from the retropharyngeal space. This space, the lateral pharyngeal space or the parapharyngeal space, is also important because of infections. So, now we come to understanding the clinical anatomy. The same picture, This is a picture showing a swelling in the region of the parotid gland, just anterior and inferior to the area of the ear. We can see it is red and swollen. It is extremely painful. So, now we can understand why swellings of the parotid are painful. They are painful because of the covering, the parotido-mesenteric fascia, which is very tough and unyielding. So, why do we get these swellings? We can get these swellings due to abscess called parotid abscess or inflammations of the parotid gland, parotitis or mumps. Looking at this diagram, we can recollect the supraclavicular space. We are concerned with one important content, that is the external jugular vein. External jugular vein is in the supraclavicular space. It passes through it, and as it passes through it, it is attached to the anterior layer of fascia. Now, if it is accidentally cut, then there is a problem called air embolism, that is, air can enter into the vein. And why this can happen? Because the edges of the vein are blend with the fascia, or the edges of the vein have blended with the fascia, and this prevents it from retracting. Hence, we can have air embolism. The next important clinical point is that the thyroid gland can have swellings. These swellings of thyroid, they move with swallowing or deglutition, and we have understood now they move because the thyroid gland is attached to the cricoid cartilage with the help of a ligament called ligament of Berry. Then next, the fascia which is covering the thyroid capsule posteriorly is not very thick, and because of that the thyroid swellings, they move or they expand posteriorly and towards the esophagus. This causes difficulty in swallowing or dysphagia. The carotid sheath, it is frequently exposed in block dissection of the neck or surgery of the neck. Infections posterior to the pre-vertebral fascia, they can erode or break through the pre-vertebral fascia, and they can come anterior into the retropharyngeal space. So, this picture is showing you that the retropharyngeal space is enlarged and there is a collection of pus. This condition is called the retropharyngeal abscess, and sometimes it can be a life-threatening condition. The retropharyngeal space extends into the thorax, and infections can spread to the mediastinum through this space and through this route. For example, the tubercular infection of cervical vertebra, which is called as tubercular caries. Then the same infection, tubercular caries of cervical vertebra, can cause an abscess in the prevertebral space, and it can track along a different path, that is along the axillary sheath, and it can reach into the axilla or into the arm. Then infections between the investing fascia and the pre-tracheal fascia, they can spread inferiorly into the chest and cause infection of the anterior mediastinum. So, now we understand that the deep cervical fascia has many clinical implications. With that, I end the topic by summarizing that the deep fascia of the neck is like a collar which surrounds the neck. It has various layers like the investing layer, pre-tracheal layer, pre-vertebral, bucco-pharyngeal, pharyngo-basilar. It forms the carotid sheath. The retropharyngeal space is an important space there, and infections can spread along these fascia from cervical region to the mediastinum or to the axilla. And we have understood why parotid swellings are very painful and why the thyroid gland moves with deglutition. With that, I end my topic. Thank you.